Hi, I am Dr. Ruchi Gupta, Senior Consultant, Obstetrician and Gynaecologist working with Cloudnine Hospital, Golf Course Road, Gurugram. Menopause, something that is very much talked about in today's scenario. The average age for menopause girls is 48 to 52 years, or on average we can say 50 years, but those who are getting the symptoms of menopause at 40, I say that it is premature menopause, which is not acceptable. Anybody who is getting menopause before 42 years needs this to be addressed by going and visiting your doctor, because less than 42 is not the normal scenario. How do you know that you are having menopause? For anybody who has not got their menstruation, somebody with regular menses but not getting it since 6 months to a year, means that you're going towards menopause. People getting other symptoms like vaginal dryness, hot flushes. Hot flushes is something that we talk about very common, very often, and we know what it is when it happens. So hot flushes is also one of the main signs and symptoms that tells you that you're landing in menopause apart from your periods. So if it is happening to you before 42 years of age, please go and visit your gynecologist. Why? Some people might say, the doc, why is it important? It's okay if it is happening a little prior. Why I tell you it's important is because this is not good. See, we need our hormones to work for us at least till 50 years of age. If they are stopping before, let's say 42 years, let's say 40 years of age, that is going to adversely affect your bones, your cardiovascular health. So in that situation, not just the hot flushes, the vaginal dryness or any other thing, we need to take care of our bone health. We need to take care of our heart also. So you might need hormone replacement therapy that your gynecologist might prescribe you after examining you and you undergoing some basic tests to make out whether you are a suitable candidate or not. What are your requirements? Do you want contraception? Has your family been completed? Do you have any other symptoms? Depending on that, you might be prescribed the hormone replacement therapy. So please don't take it casually. If you're getting it less than 42 years of age, go and visit your gynecologist. Thank you.